Hey YouTube, Marcus Green. I'm back with my series on Medicare. I am putting out this content to help Medicare beneficiaries make decisions, get their questions answered. So if you want to raise your hand, if you have a question, please call me at area code 216-644-8043. You can subscribe to my channel. You can also share my channel. You can make comments in my inbox, and I'll get back to you as well. I am also on Twitter. I have a lot of good information out there. It's Mark M. Green. You can follow me on Twitter as well. Today I will be talking a little bit about HSA accounts or health savings accounts. It's not really a big issue when it comes to Medicare, but when you turn 65 and become Medicare eligible, there are some changes that will happen to your health savings account. So I thought it was very important to address this, especially in this environment. You are seeing more and more health savings accounts out there in the marketplace. I'm actually on my wife's insurance through her employer, and we have a health savings account. And it took some getting used to be honest. With a family of four, there's a pool of money that could be put in. There's some tax benefits, but you have to use it correctly, and you do have to understand how it works and what the rules are from the IRS standpoint. So there's really three key points to remember when it comes to Medicare, if you're a Medicare beneficiary. So first of all, a health savings account can be the money's in there can be taken out penalty-free as soon as you turn 65. Okay, for any reason, once you turn 65, you can take all of your money out. The second point that is very important to make is that you can also pay for your health insurance premiums once you turn 65. And so you can use them for original Medicare, for your current employer plan, and also for your Medicare Advantage plan. But you cannot pay for Medicare supplement plans or Medicare gap plans with your HSA account. The third point is that you lose your health savings account eligibility once you turn 65. So if you have monies in there, once you turn 65, you can use them. There's also a catch-up provision after 55. You can throw an additional $1,000 in there. But once you turn 65, you cannot put any more monies into your health savings account. When you become 65, you can take a general distribution. There's two components to this distribution. There's a penalty and there could be taxes. So once you turn 65, there is no penalty. However, if you take the monies out and you're not using them for a qualified medical expense, you could be paying some taxes on your monies. So typically Medicare only covers 80%, so the 20% would be considered a qualified medical expense. So at age 65, you can use your health savings account to pay your Part A, Part B, Part D, which is your prescription drug plan. You can use it for an HMO, which is a Medicare Advantage plan. However, you cannot use it, as stated before, with supplemental insurance or Medigap insurance. You can also use it to pay for employer coverage and also for your Part B premium. So right now in your Part B, the Part B premium that has been set by Social Security is $104 and some change. If you make south of $85,000, you could pay more. So you could actually have that taken out of your Social Security check, the Part B premium, which most people do, and then actually reimburse yourself from your health savings account to pay your Part B premium. Okay? You lose your health savings account as soon as you turn 65, meaning you cannot contribute any more dollars. However, there is a provision that will allow you to catch up $1,000 additional dollars, and I believe it's capped at a savings account. There's a provision that will allow you to contribute actually after 65, and then there's a catch-up provision that will allow you to contribute up to an additional $1,000. I would check with your accountant or your CPA to follow the rules, to find out what the rules are. And then lastly, when it comes to health savings accounts, if you have a spouse that is under 65, you may be able to keep their health savings account. However, the employer plan, the employer sponsor plan, cannot make any contribution to the account. So what I would suggest is that if you're in that scenario, please contact your benefits admin at your sponsored plan to get all the rules and regulations. Again, appreciate you supporting me on my YouTube channel. You can always call me if you have questions at 216-644-8043. Check me out on Twitter, Mark M. Green. And then please leave me a comment and I'll get back to you.